Today, we will be talking about the causes of high or raised ALT, which is also known as SGPT. ALT, which stands for alanine aminotransferase, or SGPT, serum glutamic pyruvate transaminase. This is the name for a liver enzyme which can be raised in many conditions. So, if you are doing workup for a patient and you find that the ALT or SGPT, if that is raised, what could be the causes? And here we mean causes of raised ALT or SGPT in absence of jaundice. Now remember, if somebody has got jaundice or high bilirubin level and they have got raised ALT, SGPT, that it simply means that there's some form of liver damage, and most of the times that is caused by acute liver infections, especially viral infections. But today we will be talking about causes of mildly raised ALT SGPT in absence of a raised bilirubin level. In other words, we mean that we are working up for a patient who doesn't has got jaundice, who hasn't got any raised bilirubin, but you find that there is a raised ALT or SGPT. Now, the normal levels of ALT or SGPT, they are 10 to 40 international units per liter. But if you find more than this, then it simply means that there is a raised ALT. Now, the causes of raised ALT or SGPT in the absence of bilirubin, remember a few things. Number one, infections. Number two, inflammations. Number three, immunological conditions. Number four, drugs. And number five, what we call as a fatty liver, non-alcoholic fatty liver disease. Now let's take them one by one. So the first one are infections. Now the infections that would cause a raised SGPT or ALT are usually hepatitis B and C. So you should do a workup because these are common causes of raised ALT and AST, especially in the developing world. So that should be your first step. So the first step is to look if the person has got, or the child, because basically we are taking it in context of pediatrics, the child has got hepatitis B and hepatitis C. So you need to do hepatitis B and C serology or the PCRs for the presence of HB, hepatitis B viral DNA or hepatitis C viral RNA. If you have excluded the infections, the viral infections, then the second cause or common cause of raised ALT or SGPT are inflammations. Now, many conditions can cause inflammation of the liver as well. Like, for example, you can get liver inflammation in certain types of subtle viral infections like cytomegaloviral infection or Epstein-Barr virus infection. You can also get inflammation of the liver in many multi-organ conditions. Like, for example, you can get it in SLE, you can get it in multi system inflammatory disease. So you can get some form of raised liver enzyme because of mild liver inflammation. So infections, then inflammation. The third thing are immunological conditions. There are certain types of immunological inserts to the liver, which can happen in different types of autoimmune diseases, which can also happen in certain forms of primary liver immunological problem like primary biliary cirrhosis, etc. That can give rise to a raised ALT or SGPT, whatever you may call it. Then the four important things are drugs. Certain drugs can cause liver inflammation, and certain drugs like anti-tubercular drugs, and there are a wide other variety of drugs also as well. You can look it up in the textbooks of pharmacology, which can cause raised liver enzymes. So you usually ask these things in the history if the child has been taking any drugs, especially those drugs which have got some potential of hepatotoxicity. And if the child is taking that, then again you have to stop those medications or alter those medications down to a lower level. So the fourth thing is drugs. And fifth, if you have excluded inflammation, if you have excluded infections, if you have excluded any drugs as a cause of raised ALT or SGPT, then one important reason for raised ALT or SGPT could be non-alcoholic fatty liver disease. Now, many people have got fatty liver disease, and this is non-alcoholic. This is not caused by alcohol consumption, And usually what happens is that there is a lot of fatty deposition inside the liver cells, and because of the fatty depositions there is impaired cellular metabolism, leading to some form of damage to liver cells, and they are, there is rise in the level of these liver enzymes, the A.L.T or SGPT, and usually there is sort of a risk that these people may end up in fibrosis at some point in their life. So as compared to the normal people, they are more predisposed to develop some form of cirrhosis or some form of fibrosis of the liver later in their lives. So these are a few reasons for raised A.L.T or SGPT which you should remember. So once again, to summarize it, it could be infections, especially hepatitis B and C. It could be inflammatory conditions, like certain inflammatory conditions which affect different parts of the body. Number three, it could be immunological conditions. Number four, it could be drugs, especially those drugs which have got the potential for hepatotoxicity. And the fifth important one is non-alcoholic fatty liver disease. So remember these five groups of causes of raised A.L.T or SGPT in absence of jaundice. Thank you very much for listening to me. Bye bye.